Welcome back to Simply Women's Health with CJ. In recognition of Birth Defects Awareness Month, today I want to focus on birth defects, also known as congenital anomalies or congenital malformations. In the United States, approximately 3 to 4% of pregnancies are affected by some form of birth defect. Basically adds up to 1 in 33 babies has some form of birth defect. Some birth defects are very minor. They just affect your child's appearance. Some can be quite severe and actually life-threatening. So it is something that we in the medical field pay a lot of attention to, is the risk for any kind of birth defects. The most common form of birth defect or congenital malformation is a heart defect. The 1% of babies are born with heart defects, and that adds up to about 40,000 babies a year. Heart defects can be just the way that the heart was formed. It didn't form properly, or it doesn't function properly. The second most common one are cleft lips or palates. A cleft palate is when the bones in the mouth do not fuse together. So there's an opening. A cleft lip is where the upper lip has a separation in it. Those are relatively common. We see those. Those are something that you can actually sometimes see on ultrasound. The next one is Down syndrome. That is a chromosomal abnormality. Those children will have various physical features that are pretty consistent, as well as some will have some learning disabilities. The fourth one is spina bifida. That is what's called a neural tube defect. That is a problem with the spinal cord. Some can be very, very subtle and you can't see them at all, and some can be quite severe where the end of the spinal cord is actually sticking out of the baby's body. So what causes birth defects or congenital malformations? Unfortunately, the majority are random events. We don't know what caused them. We do know that there are some things, though, that you as a mom can do to try to lower your risk of having a baby with a genetic abnormality or a birth defect. So what are some of the things that cause them? Chromosomal abnormalities. Sometimes your baby will have too many chromosomes, sometimes they will have too few. For women who are over the age of 35, they do have a much higher risk of having a baby with too many chromosomes or having a baby with Down syndrome. Those patients will often opt for additional testing to make sure that their baby is not affected by Down syndrome. You can have genetic abnormalities. You could have a parent that has a genetic disease such as cystic fibrosis, and that parent can pass that disease on to their child. Or you can have two parents who carry a gene for cystic fibrosis. Neither one of them has the disease, but they are trait carriers. And if they get together and they make a baby, that baby actually has a 25% chance of having the disease, even though the parents don't have it, but because both of their parents were trait carriers, the baby is at risk. You can have uterine problems. Sometimes the uterus, the sac will kind of start to shred a little bit, and that can create what are called amniotic bands. Those babies will be born with, sometimes they can be born with missing fingers, toes. They can be missing parts of their limbs. Again, these are things that we can often see on ultrasound. Different medications can cause your baby to have defects at birth. You can have certain infections. The herpes virus, if you get an initial outbreak in the beginning of your pregnancy, that can be harmful to your baby. Toxoplasmosis, a disease that is found in cat feces. A disease called cytomegalovirus, CMV. Those can all cause birth defects. Different lifestyle things, smoking. We know that smoking does increase your risk for having a baby with a cleft lip or a palate. It can also make your baby grow smaller than what it should be. Alcohol use. Those babies can have fetal alcohol syndrome, again, with different facial features that are pretty consistent as well as learning disabilities. Illicit drug use, of course, is always dangerous for your baby. So what are things that you can do to try to decrease your risk of having a baby with a birth defect or a congenital malformation? If you're a smoker, stop smoking. If you are not currently following a healthy diet, I recommend you eat a good healthy diet. And ideally, you start doing these things even before you become pregnant. But if you are not doing it when you learn you're pregnant, then that's the time to switch over to a healthier lifestyle. Ideally, we want you to be taking some kind of a prenatal vitamin that has folic acid in it. Folic acid is a vitamin that if you are low in that vitamin, it can increase your risk for having a baby with spina bifida. We want for you, if you have any pre-existing conditions such as diabetes, make sure you have your diabetes under control. If you are an uncontrolled diabetic and you are pregnant, there is a number of different birth defects that can occur with that disease process. If you're drinking alcohol or using illicit drugs, obviously we want you to stop that behavior during your pregnancy. If you use any kind of over-the-counter supplements, that's something that I do recommend you talk to your provider about and see if those are in fact safe in pregnancy. Ideally, we want you to avoid exposure to any kind of environmental toxins, pesticides, x-rays, those kind of things. During pregnancy, we'd like for you to avoid eating deli meat, unpasteurized cheeses. Those contain a bacteria called listeriosis. Your immune system can fight listeriosis, but your baby is in your uterus. The baby does not have an immune system that is up and functioning yet. Listeriosis can actually cause your baby to get quite sick inside your uterus. Same with raw eggs as well as raw fish. We recommend you steer clear of those during pregnancy. Ideally, if you have a cat, we don't want you to be changing the kitty litter box. Cat feces contains toxoplasmosis, which can cause brain damage to your baby. Now, if you're in a situation where you don't have anybody to change the kitty litter box, my recommendation is to make sure you change it on a very frequent basis every single day. Toxoplasmosis takes a couple of days to develop, and so the longer the cat poop sits there, the more toxoplasmosis is in there. Also, make sure you are wearing gloves and a mask. Basically, as soon as you find out you're pregnant, if you start having good prenatal care, you can hopefully reduce your risk for developing any kind of birth defect or congenital malformations. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your service.